All right, so I wanted to cover a couple of things with you guys today. So there's over the last week or so, there's been a lot of change in the models and where they're going to go. So originally, it was predicted that we might get like maybe 200,000 deaths, and over time that has been downgraded to approximately 60,000 deaths. And a lot of people are asking, okay, what happened? How did that why are we down to 60,000 deaths when it used to be so bad? A couple of things happened on these models. So my favorite model, I'll pull up here, is the COVID.com health data. So it's very good because it gives you these maps that you see all the time. Talks about the usage, when we're going to have a max date of hospital usage, which is tomorrow. And these over the last week, it's gone significantly better compared to what it was. And there's like two main things that have happened. One, the United States has done a lot better social distancing than was actually expected. Most people in Italy, when they enacted the same things that we enacted, people ignored them, and people went out and people continued to get infected, and it was horrible for Italy. And so a lot of people were expecting a similar type of thing to happen here in the US, but that didn't happen. We've actually had very high compliance with the social distancing. You know, I think people got scared and everybody stayed in. We didn't have restaurants still opening, we didn't have bars still open, and for the last couple of weeks, everybody stayed home. And you know, it's been great, and we're going to have to keep this going in order to keep getting the good results. But you know, it used to be that I thought, okay, you know, we're all going to be locked up till August, and right now it looks like for California, you know, maybe mid-June we could be unlocked. Maybe, you know, I was thinking August 1st at the best case scenario. Now it's maybe mid-June because we've all been locked up. Another interesting thing that happened that allowed the hospitals to be better and allowed our death rate to go down is, you know, with all these projections, we said, okay, we have this many hospital beds, and if we go above this, all these people up here are screwed. And we have this many ventilators. What happened is normal hospital people stopped showing up. So if we have this many ventilators and we're normally using this much, these people stopped going to the hospital, and everybody's asking what happened to these people. So it used to be, okay, you have this much excess capacity. Turns out you have this much excess capacity of ventilators for COVID. So there's a lot of heart attacks, there's a lot of strokes that just are not coming to the hospital anymore. And, you know, people are wondering, where are these heart attacks? Where are these strokes? We don't understand it. And there's also a lot less trauma going on. People aren't driving their cars drunk and crashing. People are not getting in fistfights because you can't do that from 6 feet away. So all the other normal hospital people stopped going to the hospital. So we always made these projections of, oh, we have this many free ICU beds. It turns out we have this many free ICU beds now because no one's going to the hospital. So because of that, our death rate has gone down significantly because we technically have more hospital capacity. And it's had some interesting side effects. All these hospitals emptied everybody out in preparation of the COVID coming, and they never showed up. So a lot of these hospitals, they're in bad financial shape. So we don't know where these patients went. And a lot of these hospitals are having major financial difficulties because of it. A lot of doctors are having major financial difficulties. Don't feel too bad for the doctors, but there are practices that are going to close because they're not able to make their money. You know, they're not able to pay their staff. And, you know, there's going to be a lot of, this will completely change the healthcare system. We don't know how, but, you know, I know that I'm effectively kind of sort of unemployed for another 2 months until this gets back. You know, I'll still be working, but I'll be making much less than I used to. But I still have a job, so I can't really complain. But all this, my point is that all these people who are not going to the hospitals made us better prepared to prepare for COVID, better prepared to handle all the patients in COVID. And interesting things that's happening is we're getting a lot more dead-on arrivals when we're calling 911. So at least in New York City, I'm not sure this is accurate other places, but New York City, you know, you have a certain rate of, hey, when you get a 911 call, you know, maybe 1 out of every 20, you arrive and you pronounce the person dead at the scene. They're getting a huge rate of people who are dead at the scene. And we're not just talking about COVID people, we're talking about heart attacks, strokes, stuff like that. So there are a lot of people who are dying at home that the hospitals never get to, and there's plenty of theories about why that's happening. One of the current theories that I read out there that makes the most sense is because these people don't have other people living with them, they might not notice, or it might be too late. Someone has difficulty breathing, and like if you're a grandmother and you have difficulty breathing and you have grandchildren, they're like, hey mother, you don't look good, let's go to the hospital. But if you're at home, you might have difficulty breathing and it gets so bad that you can't make it to the phone anymore. And so you're getting people who are ending up dying at home from things that they wouldn't normally die at home from. So if you have someone, this is advice, if you have someone who's elderly, check in on them. If you have someone that you normally would see, that even if they're not elderly, just check in on them. One of my friends, Lindsay, she didn't hear from her dad for 2 days. And it turned out he fell down, might have broken something, and she called the cops. He lives in Texas, and the cops went and broke down his door, and they found him on the ground for 2 days. So, check on your grandparents, be sure that, once every 2 days, you check on every person that you know that might have a problem, so that, you could be sure they're safe. So that was the main thing that I wanted to talk about with the projections. So right now, California, I'm going to pull this up for you. And so this changes like day to day to day to day. But this is a California, I know it's going to be reversed from you. This is a California map right now. And you can see right about May 1st, we're at about April 10th there. Right about May 1st, you start getting a lot less cases. And in June 1st, it's going to say we need no ICU beds, need no hospital beds. And that doesn't mean that we're going to end the shelter at home on June 1st. There will be still people with the disease out there, but it does mean that our hospitals could handle it. So we're still going to end up having the shelter in place continue after June 1st. But it'll be different. So for me personally, like my parents have been on lockdown, and I thought they were going to be on lockdown until April 1st. Like no one could see them. Their relatives can't see them. We could see them because we were alone for 7 days. But right about May 15th, I think it's okay to like see some of your relatives. You could do your own little social relaxing. But we're still not going to have restaurants open. We're still not going to have bars open. The grocery stores, how you shop today at a grocery store, that's probably going to continue for a long time. I don't think bars will be allowed to open, and I don't see sporting events happening this calendar year. Maybe in October, November, December if we're lucky, but I don't think sporting events with fans will happen this year. But as far as California goes, we're pretty well off. We have the hospital capacity because we social isolated, and we're going to be able to make it longer. This is one of the things that I was actually wrong about my predictions. I predicted that we'd still have a lot of cases coming in up until September. So I'm happy to be wrong about that. I have a list of things that I've said that's been wrong to date. The other thing I wanted to talk about is serologic testing. So right now, I've explained it before, there's a test where you stick a Q-tip in your nose and you check if you have viruses at the back. The other test that you could check is you pull out blood and you check if there's antibodies in your blood to this disease. And those tests are being made right now, and they're starting to become more common. And an important decision to figure out when you open up and what you do is you need to find out how much of the population has had the disease. Once you get to 70%, you have herd immunity. This disease doesn't find many people to infect, so effectively you can release everybody and you'll probably be fine. The way you check that is you basically take a random sampling of 1,000 people in Los Angeles and you check their blood, whether they have symptoms or not. You just pick a random 1,000 people and you check their blood and you say, hey, how many people have the antibodies? And based on that, you can start making decisions on what to do about relaxing things. Once we get to 50%, it's like, okay, bars can open again. Once we get to 40%, it's like, okay, restaurants can open. Now, there's been a news story around, which I've seen, which has killed me in no end. I've said it before, only trust stuff you see on LA Times, CNN, or New York Times. There has been an ABC News story down here and a ABC News story up in the Bay Area that's complete bullshit. So we are starting to do the blood tests to figure out the prevalence, the number of people who've had the infection in Los Angeles, so we could have a baseline. We're like, okay, at this point we had 5.7%, and then 3 months from now it's like 10%. It's so that we could track this. That's why we're doing this test. There was a guy who was on the Rush Limbaugh show. He is a Stanford Hoover Fellow in military history. Now, if you ever hear of the Hoover Institute, it's a right-wing institute, and you shouldn't believe anything that comes out of him. But he was on Rush Limbaugh, and he said, hey, they're doing this test, the 1,000 people, to figure out how much is there because people were infected in November and December. Now you're asking, why is Rush Limbaugh talking about this? California, Washington, and Oregon have done this the best, and Rush Limbaugh doesn't want the Democratic governors to get credit for it. He doesn't want Newsom and Inslee and all them to be like, hey, we did this right, Trump did it wrong. So they've been spreading a theory that, hey, it happened in California in November and December. Now this Hoover fellow said on the Rush Limbaugh show, hey, they're doing this test to show that we were infected in November and December, and that's why it wasn't so bad in California. That is a complete lie. This guy is a Hoover fellow who studies military history. He has nothing to do with the serologic test that Harvard is doing. The serologic test that Harvard is doing is to see the prevalence of stuff, to see who has it. It has nothing to do to check if people had it in November or December. No one thinks they had it in November, December. There is no possible way that someone had this disease in November or December. And we'll repeat that. This disease was not in the United States in November or December. I don't care how bad a sickness you had. I don't care how much you were laid up. You did not have this disease. So let's say this disease, for every one person, they infect 3 people every 3 days. So if one person had this disease November 15th, that means 9 had it on the 18th, 27 had it on the 21st, 90 had it on the 24th, and so December 10th you would have 10,000 people have it, and roughly January 5th every person in California would have had this disease if one person had this disease in November. So I keep saying people, oh, I was sick in November, oh, I was sick in December, I probably had it. No, you did not. I was overhearing Jackie's class today, and someone said, oh, I think I had it in early January. Probably not. It's within the realm of possibilities that you had it in early January, but you didn't. Now, probably didn't. So there's a lot of people who think they're sick right now in Los Angeles. So this is some very interesting thing. So the UC system has started publishing a lot of their data on Twitter. And so let me find this quickly. I bookmarked it on my page. So the UC system, I did not bookmark it on my page. Why do I not have it? Anyway, so the UC system does their own testing. They have their own lab, and all the UC hospitals does their own testing. So they actually could check what their prevalence is. So only 5% of the people who go to UCLA to get tested have the disease. 1 out of every 20 people who gets tested at UCLA has the disease. That is an extremely low amount. That means that in all likelihood, only 1 to 2% of the people here have the disease. In New York City, it's a vastly different experience. In New York City, 41% of the people who get tested have the disease. So 4 out of 10 people will be immune in New York City in the next 10 days. So that has very interesting differences. So if you're in Los Angeles and you think you have it, you probably don't have it. If you're in New York and you think you have the disease, you probably have the disease. I'll find that for you, Sandra, at the end. So it's very interesting that, the results here, because we did the social distancing, are vastly different than New York City. So Whitman, I'm going to answer a different question you asked right now. Why is New York City so screwed compared to us? A lot of people say, hey, it's high density. You have people living in high rises. You have so many people touching things. That is completely true. But San Francisco and Seattle are very similar cities that have not had nearly the same amount of infections per people as New York did and they're just as dense. Downtown LA, we are just as dense as New York City. Koreatown is just as dense in New York City, but we did not have the same experiences. What's the difference? There's two things that happened. One, they found out that the disease was in New York City a lot faster than it was expected. It was going around in February, versus here in Los Angeles, there wasn't as many people. I don't know, where did I find this? There was an ER doctor, I think at NYU, who said, we're just testing the next 150 people who come in through the door to see how many people have it. And this was like late February, early March. I don't know the exact time. And they had an absurdly high number of people who had it in New York. And when they looked back at their data, they had an extremely high number of people in January and February who was showing up for cough and fevers that they did not realize was COVID at the time. And so it was only when they looked back at their February data that's like, hey, this is abnormal. We normally have this number of people who are in for cough and flu, but we have this many people. So it was circulating in New York City a lot earlier than everywhere else. So that's why New York City, that's one of the reasons that New York City got hit so hard. The second reason is we shut down a lot sooner and we had a lot more enforcement. So when the Bay Area shut down, they were the first people to shut down, and London Breed, who I donated to, she got the San Francisco's unique in that it's a city and a county at the same time. London Breed got all the surrounding counties and they all shut down at the exact same time. 7 or 8 counties in San Francisco shut down. New York City was a vastly different experience. When there was talk of them shutting down, the mayor of New York City said, hey, everybody should go out and enjoy one last night before COVID gets here. All their city council people were saying, hey, enjoy the Chinese New Year because, we don't care about COVID. This is not going to be a problem. And so those were events that caused mass spread in New York City. Los Angeles, San Francisco, we did not have those events. We shut down before St. Patrick's Day, and New York did not shut down before St. Patrick's Day. That's the biggest difference on why New York is so screwed right now. Don't get me wrong, high dense places has a lot higher chance of getting infected than low dense places, but that's the biggest reason why you see New York a high dense place versus San Francisco high dense. And it's also like when you look at the individual parts of the city that gets high infections, it tends to be the lower socioeconomic people, the people who live 5 people in a house, 6 people in a house, because once you're infected, you're likely to infect everybody else in your house. And when New York shelters in place, they have no other place to go. There's a lot of people who are like 7 people in an apartment, and once one person gets it, they're all getting it. So that was another reason why New York has spread so much compared to everywhere else. So I forgot where I was on my thing. So it was very interesting. Even Jackie's, the head of the USC EMBA program said, oh yeah, I think I got it in January. My wife came back from a ski trip and she was sick, but I didn't feel it myself. I'm like, no, that didn't happen. So we've been loaning out ventilators. So California had a lot of ventilators because we're like, okay, we need this many. And as I explained earlier, we're missing the normal people. So it's like, okay, we don't need that many. We need this many. So California has been loaning out ventilators to New York City and places like that. Now, Riverside is like, why are you doing this? We need this on April 26th. We'll get those ventilators back. But right now we have an excess of ventilators, and those ventilators will save lives. New York City, because they had so many people get infected early, they're going to drop sooner than us. So 2 months from now, New York City will be safer than Los Angeles because we're still being sheltered in place. We'll still have a couple of low-level infections around here versus New York City. It would have completely burned out because so many people got infected. New York City might have an incidence of 20% people infected. The difference is New York City had a lot of people die and we didn't because of that. So a couple of things that I've been wrong about. 1.2 million people dead. We're probably going to end up less than 100,000. Right now, Trump is saying, I want to open up the government again on May 1st. That's not going to happen. There's no chance in hell. I thought we'd be locked down till September. I think we'll be effectively locked down till the mid to late June. I've also been wrong about the stock market. I thought the stock market would hit its low within the next week, and because this next week is when we're going to have the highest death rate of any time, and it's going up right now. I was not expecting that. I think a lot of people in the stock market started saying, hey, we're turning the corner because we are starting to get some good news out there. New York is starting to go down. California never went up. We're starting to get some good news out there. California flattened the curve, and, we weren't expecting it. So I'm going to talk about a couple of housing things, since housing is one of my favorite things out there. This will ruin the economy in a lot of ways, because people are not shopping, people are not spending money, and this will ruin the local government's finances, because a lot of local governments depend on the sales tax to balance the budget. California depends on the stock market to balance the budget. So we're about to have a lot of local governments bankrupt 5 to 6 months from now. A lot of affordable housing developments depend on tax rebates. So rich people could donate money to affordable housing and they get a specific tax rebate. It's a specific manner that's used to fund affordable housing. That's going to dry up. There's a lot of things from California that's based on tax revenue that will be dried up. So a lot of these affordable housing projects, they're not going to happen. I don't expect us to have more affordable housing projects built for years. Generally affordable housing projects need about 6 different funding streams for it happen. Like Measure HHH, that'll still be there, but they'll lose 3 of the 6, so they'll never be able to happen. A lot of the normal housing, unless you're pretty far down the road, will stop happening. So I expect that we won't have another groundbreaking. We might have like 2 or 3 or 4 groundbreakings in Los Angeles over the next year, but that'll be it for a year or two. The housing market we won't get new housing. Now, a lot of people said, the economy is going to crash, so therefore rent and housing will get cheaper for everybody and we could afford it. The problem is that, yes, that is true. Rents will go down, housing prices will go down, but so will people's income. So if you are this level, your income's going to go down like this. Housing market, your income will go down like this. Rent will go down the same amount. So even though like a 1-bedroom that would have cost $1,500 will now cost $1,200, you would be making less. You still can't afford that 1-bedroom. It's still a supply and demand thing. We're not having that many people die off here in Los Angeles that, we're going to have so many more apartments compared to people. Right now we have this many people, we have this many apartments. This mismatch is what causes the housing crisis. That doesn't change. If you look at earning versus rent, both go down, but that mismatch is still going to be there. So the housing crisis is still going to be there, and because we're not going to be able to build anything, it's going to get so much worse. Another interesting, sad thing, there's a lot of people who've been living in their apartments for 30 years here in Los Angeles, and they're rent controlled. And the way rent controlled apartments work here in Los Angeles is it doesn't go to it's not set to inflation. So $10 10 years ago is worth $11 today. Rent control made it so that the rents kept going down while inflation went up. So basically, someone who's living in their apartment today would be paying less than they would have been paying 30 years ago. So 30 years ago, they got an apartment for $300 a month, and that was market rate. That's what everybody paid for that apartment. But as they stayed in it, it went to $350 a month. But if they were kicked out, it would be worth $1,100 a month. A lot of those people are not going to be able to afford their $350, and those apartments will go back to market rate. They're going to lose their apartments and get kicked out. So it's going to be very sad here in Los Angeles. There's going to be a lot more people who are homeless from those apartments who could barely afford to live here. But if you're 2 steps above that, those apartments will open up. So it's going to be, as sad as it is, slightly better for the middle class, but much worse for the lower class. All right, so I'm going to go to the questions now. I'm going to start with the old questions I had from my first one today. Okay. Manish, you keep asking a hard question. So Manish, this is going to be a hard question. What are the thoughts of the cross-reactivity of coronaviruses in serologic tests, and how does it affect sensitivity and specificity? So this is called COVID-19. It's called 19 because that means there are 18 other COVID viruses that we know. The 18 other COVID viruses that we know did not cause deaths. they cause runny noses in kids. It's the common cold. So everybody has had a COVID infection before. This is just the first one that killed people. Now with this blood test, you're looking for something that's reactive to COVID-19. But you might have these antibodies also binding to COVID-15, COVID-14, COVID-13, and that will completely screw up this test. So that is why it's kind of hard to make this test, because you have to have a test that only recognizes COVID-19 and not the COVID-15 and COVID-13 that other people have had. So, there's a lot of problems with this, because those current tests are identifying those other COVIDs that are not bad, that everybody has had, and it's what's called a false positive. It says that people had this before when they actually didn't have it. It says that people had COVID-19 when they didn't have it. So, we'll know more about those tests when we start rolling them out. But, that's a very hard question. Okay, Scott was going to ask about so this is the thing about that Hoover fellow that I was talking about earlier. And I talked about how you did not have this disease in November or December. Please stop saying you had this disease in November and December. You did not have it. But I basically covered that before. Where do you think America will be as a country 1 year ago from today? Remember, plug your mic in. 1 year the main difference is that I'm going to say sticks from now to 1 year from today. I think handshakes are dead. I think high fives are dead. I think that the way we do grocery shopping, there will be some form of that. It could be that 1 year from today we don't have a vaccine, but it's gotten safer. So we'll have requirements of having a mask to go grocery shopping, or having a mask to go into places where other people go. And I doubt the restaurants will be able to open up by then, but if they do, it'll be very strange, because the servers will definitely have masks on. But I just think masks will be a lot more prevalent. I don't think sporting events will be different. There'll probably be temperature checks as you go into sporting events. And who knows, you might be required to wear masks. The bad thing about sporting events, the worst thing about sporting events, I told you the story about a choir practice up in Washington where 6 of the 60 people, 45 got infected. That's because they were singing, yelling during the entire thing. A sporting event is exactly like that. There are so many times where it's third down and everybody's going like, "Wah!" That is just coating everybody with potential viruses. And so that's why I don't believe that sporting events will actually be able to reopen with fans for a long time, because, a lot of the sporting events is people yelling, and, you can't yell. Maybe a sporting event with everybody having masks, but, I don't know how that would work out. So, those are some of the changes I'll have from a year from now. Any info about the antibody testing that might... okay, so no one has ever had this disease twice. That's another thing. No one had it in November or December. No one's had it twice. Once you get it once, you have antibodies. You fought it off. Those antibodies protect you a second time. It will probably be another... I'm going to jump back to this. What is required for us to reopen the country? One, we have to get the current level of people who have it so low, much lower than it is now, so it decreases the chances of infection. Two, we need to have good tests, and we need to have a lot of tests. We have to have tests to see who had it in the past, and we need to have tests to see who had it in the future. In the past, we need those tests to say, hey, these people are good, we don't have to worry about them. We need a lot of tests at current time, because once we get it down so much, we need to start checking people who show up to the doctor's office, say, I have a headache. Okay, you get a COVID test. And we find a lot of those people are going to be positive. So, all those headaches that are positives, once we find that positive, then you're like, okay, who have you talked to? We need to go test those people. We need to have that ability. We don't have that ability right now. If someone's positive, we don't go check who they talk to. And we don't have enough tests to go do that. So we need to set up an entirely new health system so that, once we get the disease so low with social distancing that's like, okay, it's gone, we have to have enough tests that we could test people who show up at the ER, people who show up at doctor's office. And then we have to have another set of people who will go track down every person that they've talked to and get them to self-isolate or test. And we'll need about 5 million a year for the United States, 5 million million tests per week or so for the United States in order for us to reopen. Trump's, we're nowhere near that. We could test maybe 100,000, maybe about 500,000 per week right now. So we need to get 10 times the number of tests. And so whenever Donald Trump says, oh, we're opening May 5th, oh, I have to listen to the doctors. The doctors know that's what's needed. No doctor is going to recommend reopening until we have that. Now, the great thing about California is we are so big and we have a governor that's on top of it, that they are working on that. They are working on getting their own tests so that California could do it on its own. We're not going to depend on the federal government at all. We are going to basically set up our own system to do those things. We're going to set up our own testing to be able to have enough tests for California. And an interesting thing is California might make money off of these tests. Like if California sets it up and they're like, okay, we have these tests, we're pumping out, we're going to be selling them to Utah, we're going to be selling them to Florida, we're going to be selling them to Georgia. And, we're going to be much better off in California than we are than everywhere else. Now, what's interesting is there's been, like I've said, we are so lucky to have Newsom. He is smart. The governor of Florida yesterday said there has never been anybody under 25 who's died of this disease. That's completely wrong. And as you recall, Florida still had their beaches open recently. The governor of Georgia didn't know that there were asymptomatic carriers until yesterday. Bill de Blasio, the mayor of New York, only said last week he found out, hey, there are asymptomatic carriers. Georgia and Florida are about to make horrible decisions about reopening faster than they should, specifically Florida. Florida is about to be screwed beyond belief if he actually follows through with his plans to reopen. So, it's going to be interesting. I mean, Miami, I think that the medical people will stop the governor of Florida from reopening, but if he does reopen everything, which he says he's going to reopen the schools, if only for a week, it's going to be a disaster beyond belief in Florida. So, it's going to be fascinating. I mean, the only reason Florida started locking people down is because about half a month ago, President Trump said, oh, this is dangerous, we need to care. We'll see. I mean, if President Trump starts going back to, hey, this is just, something we could get by, the governor of Florida is probably going to put people back in school, and it's going to be massively horrible. All right, let me check down the... How is the salon industry ever going to reopen? Our livelihood is dependent on people being able to touch people. I don't think the salon industry will be able to reopen for a long time. I just don't see it happening. All you people who are asking questions right now, I'm going to ask you to do it again in a bit. I can't always get the questions as you're doing it. But, I just don't see a way that salons could easily reopen. Same with makeup artists. So many of the things that require touching until we have a vaccine is going to be very hard. If you have a different job that you could do for a year, you should go do that. Some job where you don't have to touch people. So someone asked about Mardi Gras and the Super Bowl and asked whether these were key launches of the spread. It's pretty much proven that Mardi Gras and St. Patrick's Day are the two biggest holidays that if they happened, it caused a spread. In New Orleans, there's a daily episode about it, how Mardi Gras basically screwed all of New Orleans. There were cases in New Orleans that people were not expecting, and it went across the board. And, in those early days in February, it killed me in no end here in Los Angeles, too, where people are like, oh, we have cases, but there's been no community spread. I'm like, basically, a lot of health people who should have known better didn't do the right things in February that would have stopped this. And, people should have known better that, hey, there are people randomly walking around with this disease when you found some people in Los Angeles, but they were saying, oh, we haven't found those people, they don't exist. And, well, I don't know how to talk about that easy. But Mardi Gras had a huge impact. Super Bowl, probably not because it happened earlier. And you see the difference in Mardi Gras, New Orleans versus Miami Super Bowl. New Orleans is about a week ahead of Miami of how bad it is. And that happened because of Mardi Gras. Super Bowl, Miami is on par with a lot of other cities. So the Super Bowl didn't have much effect. Let's see. I talked about that. The definitive test for acquired immunity is antibodies alone. That's the only way you can tell if you've had it. When will the hotel and event industry, and when will When will hotel and event industries come back to life? I don't know. I mean, the event industry, I don't think we'll have concerts for a while. I don't think we'll have most of those things. Hotels, you know, when are people going to be able to travel again once we get a vaccine? It could be that hotels are basically screwed for a year, you know. And there'll be some cheap hotels, you know. I might go to Vegas in summertime and be like, hey, I'm hanging out in a hotel. We'll see. Late September. It's possible. I don't think schools will be able to open again until September at the earliest. Let's see. I talked about a lot of those other things. But yeah, schools won't open until September at the earliest. Nick asks if the curve is flattening. You know, I mean, basically, there's two different terms of flattening. It's basically, are you doing better than expected? California is doing better than expected. We are not at the point where we are having less cases per day than the day before. And that means that, you know, once we get, each day we have about, I don't know how many people, each day we have about 1,000 new cases in California. And, you know, it keeps going up. It's like 1,000, 1,100, 1,200, 1,300. You know, if it starts flattening when you get 1,300, 1,300, 1,300. That's good news. We have yet to get there in California. New York, you started to have flattening of their super high numbers, and they've had flattening in their hospital admissions. But you know, we haven't in California, and part of the reason we haven't gotten to the flat part yet is because we're doing so good. So I mean, yes, we are flattening the curve. Instead of having this, we're having this. So the curve is flatter, but we haven't reached the part where it's like coming back down. So we are like, if this is a curve, California is somewhere right about here on this curve. Yeah, schools are important at spreading viruses everywhere, and they will not reopen for a long time. Okay. Yeah, schools are important. If you guys asked me a question on this thing earlier, please re-ask it. I am not able to scroll all the way back on this video for questions that you guys asked earlier. So if you guys asked a question earlier, please re-ask it right now. I'm going to go through the questions right now. I can only load up the last 10 comments or something. So we are Americans. We shouldn't be, since that's the entire point of a handshake. Will Orr, I don't know who you are, but I don't think you understand exactly how this disease gets transmitted, because if I'm sick with this hand and it has a disease and this is someone else's hand and I go like this hand is now sick. We are not going to have handshakes again. Someone said, we are Americans. We shouldn't be scared to shake hands. No, that's stupid. I mean, the entire point of having a shaking hand is so that you don't have a gun in your pocket. You know, I mean, granted, in Americans, we might have a gun in our pocket, but that's the entire point of shaking hands. We will not be shaking hands again. If you think shaking hands is American and we need to do it because it's American, that's just stupid. Why is Louisiana so messed up right now? Louisiana is so messed up right now because of Mardi Gras, and they didn't do social distancing earlier. And so that's why Baton Rouge, that's why New Orleans is messed up. Let's see. The 84% of the people who have COVID have a fever, but there's still 16% who doesn't have a fever. And there are so many different symptoms that this disease could cause that a lot of the places with lots of people getting infected, they just started testing everybody, and so many people came up positive. You know, abdominal pain, they test, it's positive. So, you know, I mean, here in Los Angeles, like I said, only 5.7% of the people getting tested are positive. So it doesn't apply here in Los Angeles per se, but in New York, if you have almost any symptoms, you probably have it. Here you don't, but you can have COVID without a fever. You can have COVID with a headache. You can't have COVID with dizziness. You can have COVID with loss of smell. There's so many different things that COVID could present as right now that there's nothing that's very definitive. Let's see. I haven't heard of the virus spreading by food or food handlers. Have you? The virus has spread in every single way, but it's not as common that it's spread by food or food handlers. You know, I mean, I haven't noticed, I haven't seen reports of it. You know, I fully believe that takeout food is pretty safe. Now, don't get me wrong, the safest thing is to have cereal dry with water and never touch anybody again. But comparatively, takeout food is not that risky. What are the chances of COVID returning as a seasonal thing, and if it does, would it be stronger than before? So the biggest fear about COVID is that people will lose their immunity to it. So the common cold is also a different form of COVID, and a lot of people, they have antibodies towards it, and then 4 months later they lose their antibodies. It's not like mumps or measles where once you have antibodies it stays for 10 years. So one of the biggest fears is that people get it once and 2 years from now they might not be immune to it by then. Hopefully we have a vaccine, but it is possible that this will just circle the globe over and over and over. But by the time we have a vaccine, it doesn't matter because we'll just get vaccines every single year, and that should completely shut it down. Okay. Will the quarantine last until vaccines appear? The Spanish flu had the highest rates of infection on the second spike after the quarantine was laxed in October. So this is why we're going to be locked down for a long time, because the second we unlock ourselves, we're going to have a skyrocketing up of the curve again, and we're back to where we were. So if, come July 1st, we say, okay, everybody go back to normal, it'll be like a complete shoot up again. And, September 1st, we're going to have everybody dying again. So that's why we're not going to have we're not going to have things open up again. And that's why, like hair salons, I don't think will open again. And that's why stuff like that, I don't think will open again until we have a vaccine. So the Spanish flu, it was November, it was in 1918 and 1919, and most people died in the second one in 1919. Okay. What are the chances we'll have therapeutics much quicker than vaccine? So this is one of the main things. There are one of the great hopes is not just a vaccine, but we'll figure out how to treat this. Now the president always says hydroxychloroquine. Oh, why am I blanking on the name? I don't know the name. The malaria drug. The president always says that malaria drug. There has been no proof that has been effective against COVID, and in fact, it's very dangerous for people with heart problems. So, he keeps saying, oh, everybody should take this, but that will kill a lot of people. In Africa, it makes a lot of sense because malaria kills more people, and so it's good to be used in Africa and India because, okay, we'll stop malaria and then we'll still kill the people with some heart problems. So for those of you who watch This Is Us, what's his name? Jack Pearson would die from chloro. I am blanking on the name. So we can't use that drug unless it's super effective. There are antiviral drugs which will probably be effective, or it could be that we could figure out certain anti-inflammation drugs which will decrease the fatality rate 50%. Those are the kind of things that we need to hope for. Mostly my biggest hope would be in the antiviral drugs, not the other things. We'll see how many more of these I do. There hasn't, like the one I started a little while ago, no one tuned in, and then the one I did 5 days ago, granted I had microphone issues, but no one watched it. I'm not sure how many people are, how much new information comes out that people would find useful with me talking about it, because there's not that much new information right now. I'll talk about some things, but I've pretty much covered everything that could be covered. So I'll start collecting stuff, and I might be doing this once a week now, if that, compared to what I was doing every 2 days. But we'll see. Are there any countries that are not affected? No, almost every country is affected. There are so many people who say, oh, 5G causes this. There are 5 countries that have 5G, but there are 152 countries that have COVID. Some people are just not smart enough. I mean, this pandemic has made me delete so many friends because it kills me. Not that there are people who are not smart enough to know that stuff, but there are people who are willing to stick to their guns of, oh my God, this is causing it, no matter how many different ways you prove to them, no, that is stupid, that is a bad idea, there is no facts behind it. They're like, oh, it still could happen. I'm like, oh my God. So it kills me. What are your thoughts of the doctor that says you could just do quinine and zinc? If that was the doctor who was passed around on Facebook, he's full of it. If it's not in, there's nothing that we could do for ourselves at home I absolutely would not take quinine and zinc, because if you have an underlying heart problem, there's a good chance that could kill you as far as your heart goes. Let's see. I'm waiting for a couple of other things. What about the Caribbean islands? No, they're all infected. I would not feel, if you're going to the Caribbean island, you stand a good chance of getting this disease in a place that does not have the ability to take care of you. Is it safe to jog outside? It's safe to jog outside. You need to keep at least 12 feet from everybody else if you are jogging outside. But it's totally safe to be outside. If you're outside and you could keep 6 feet from other people, you're safe. You need to keep at least 12 feet from anybody exercising, because the people who are exercising is spraying stuff all over the place. So if you're out and you could keep 6 feet from everybody, you don't need a mask on. If you walk within 6 feet of people, you need to put your mask on. If you go into a place with other people, you need to have a mask on. If you're out running, you could run and be safe as long as you're not near anybody else, as long as you don't get within 20 feet. So if you live in a residential area, sorry, Ashley, you don't, run in the middle of the street of a place that doesn't have many cars, and that's safe, totally safe. Let's see. I'm getting some of these. Dumb question, but how did this spread? Like, what is a community spread is in Antarctica? This spread everywhere because it is much more contagious than most of the diseases out there. There's a couple of them like smallpox, Ebola, that's super contagious, but this is much, much more contagious than the flu. There's plenty of, in the flu, there are plenty of people who would not catch the flu if you happen to be in the room with the people. But in this case, this disease, if you're on a subway and you cough in your hand and then touch something and then someone else touches it, you have a strong chance of getting it. And that's how it spreads so quickly. All right, any last questions? Yeah, Ashley/James Wild said that she's been running in downtown next to the convention center. That's a very safe place to run. When I lived in downtown LA, I found that the fashion district was empty, but I would not run there at night. So if you're running at 5 or 6 p.m., Ashley, you could probably run through the fashion district and not see many people, maybe 6:30. All right, if there's no more questions, I'll end this and put this up. Like I said, I'm going to be cutting back on these videos because there's not as many people watching and not as much stuff to talk about. Should we wear a mask when we go to the supermarket? Yes. You're going to be wearing a mask till you go